Thank you all for joining us this afternoon, and I'm excited to welcome you, distinguished delegates and civil society, to today's session. We are convening today on the margins of the 78th Annual World Health Assembly to harmonize a shared agenda and focus on how to deliver on universal health coverage in this current moment. We are seeing a global pushback against gender equality and the principles of human rights to health, which are inextricably linked. In my mandate as the Special Rapporteur on the right to health, I have investigated the right to health through various lenses and recommended a human rights approach for many of the thematic areas. Recalling the political declaration of the high-level meeting and resolution adopted by the General Assembly in 2019 on universal health coverage under the theme Universal Health Coverage, Moving Together to Build a Healthier World, I stress and underscore that universal health coverage is fundamental to reducing health inequalities, ensuring just, peaceful, and inclusive societies. The world is experiencing protracted war, humanitarian crisis, economic crisis, climate crisis, genocide, which have all had an impact on the right to health, reminding us of the interrelated human rights issues that operate at different levels in clinical care, at the level of health systems, and in underlying determinants of health. Political determinants of health in an era of pushback against gender equality and human rights are thrust center stage as leading causes of inequality, violence, stigmatization, discrimination, and criminalization. All are incompatible with the realization of the right to health and therefore impact universal health coverage. Delivering on UHC in an era of pushback against gender equality and human rights must consider that every human being is entitled, with no discrimination, to the enjoyment of the highest attainable standard of health and also a life conducive to a living of dignity. The right to health contains freedoms and entitlements, and the freedoms include the right to a system of health protection, which provides equality of opportunity for people to enjoy the highest available standard of physical and mental health. And so we must speak out against how the anti-rights and anti-gender threatens to reverse the gains made on UHC, threatens to reverse the gains made against gender equality and sexual and reproductive health rights across the entire globe. A human rights approach to universal health coverage in this moment of pushback against gender equality and human rights must center the key principles of non-discrimination, equality, meaningful participation, transparency, accountability, and these are not just mere aspirations, they are non-negotiables to the realization of the obligations under the right to health. And so I call on all of you as important stakeholders to pay attention to the situation of groups in vulnerable and marginalized situations, such as, but not limited to, children, adolescents, women and girls, persons with disabilities, migrant people, refugees, LGBTQIA+ persons, and older persons. We have learned that prioritizing one right of one group of rights over another leads to detrimental outcomes and systemic violations of human rights. I wish to call for a review of the systems we have inherited, those who those systems harm, those who get left behind or continue to be made invisible. We must move to a bold reimagining of public health governance and international solidarity. The extent to which human rights are respected, fulfilled, and protected, and concrete and formidable pushback on anti-gender and anti-rights movements will ultimately determine the success of universal health coverage. Thank you very much.